We are going to review the equipment required for surfactant replacement therapy. One of the things that you can do in order to make this an easy procedure is to build a surfactant kit using a biohazard bag. So this is a pre-packaged catheter that has 3 different size endotracheal tube adapters, as well as an adapter plug and your multi-access catheter for administering surfactant. In addition, we also have a couple 10 ml syringes, a blunt fill needle, 1 or 2 in your package, and then some SoluPrep or alcohol wipes to clean your vials of surfactant off as you're preparing to draw them up. Surfactant must be kept in a refrigerator or frozen prior to use. If you are anticipating the use of surfactant, it is advised to retrieve the surfactant ahead of time to warm the surfactant up to room temperature. It is advisable not to shake and cause bubbles in surfactant, but you can agitate it slowly, just like this, in your hands in order to mix all the medication once it is warmed to room temperature. We have a 25-week baby that has already been intubated with a 2.5 endotracheal tube. You will need the 2.5 endotracheal tube adapter, your small end of your multi-axis catheter will then attach into the adapter, just like this. And we'll lay that out until we're ready to use it. We then are going to prepare our dose of surfactant. In this case here, it is BLES. We will grab our 10 ml syringe with the blunt fill needle attached. We've already warmed and mixed the medication, so it is prepared to be drawn up and administered. We will take our alcohol wipe and just give a quick clean here. Turn over your vial. And because this child is 750 grams, we weighed ahead of time. The standard dose of BLES is 5 mils per kilogram. We are going to draw up 3.75 mils of BLES in order to administer. The other thing that we want to do in order to help our BLES get all flushed into the baby's lungs is add about 2 cc's of air in behind BLES in order to flush all the medication through the catheter once we administer it. So baby has been intubated, the tube is secured, you have verified the position of the endotracheal tube via chest x-ray, which is ideal prior to administering surfactant. We are now going to prepare the baby for delivering surfactant. So we will have to remove the endotracheal tube connector that is currently attached to the endotracheal tube. So you can have your assistant do that. We are then going to attach our Y adapter with the multi-axis catheter to the patient's endotracheal tube, and then we can resume manual ventilation. Okay. We now need to determine the appropriate depth that we are going to insert our catheter into the endotracheal tube. So the best way to do this is to verify the last centimeter marking that you see here, which is currently 13. It is about a centimeter still to the hub of the endotracheal tube connector. So I am going to add another centimeter to that, and I'm going to use 14. In order for me to ensure that the tip of the catheter reaches the tip of the endotracheal tube, I want to add 5 centimeters to that measurement of 14 centimeters. And I want to observe that 19 measurement here in my observation window. And then I want to find 19 on my catheter. We have our surfactant here. I'm going to attach it to my catheter. So again, advancing and pulling back on the sheath. There we go, 19. Okay. The last couple cc's is just going to be air. Bag it in, and as your partner is still bagging in, you remove your catheter. Okay. Watch for signs of desats and bradycardias, which are quite common after administration of surfactant, but within a couple minutes you should be able to see their SATs improve and wean their FiO2. In order to prepare the patient for transfer, it's advisable to remove the catheter. Actually, we'll leave the endotracheal tube connector in. We'll just keep the Y adapter in because we could put inline suction, or we could just occlude it with the stopper. It is ideal not to suction your patient for 4 to 6 hours after surfactant administration unless absolutely necessary.